specialist in this area and who could tell us a bit more about it, because kidney disease is known as a hidden killer. Nobody really knows when they have kidney disease. It's not something that has a lot of symptoms. And so for me, it was one of the worries, because I know that a lot of Afro-Caribbean people have kidney disease, and it's important that we know and understand when to go and get checks, and also how to spot the difficulties. So as usual, please be interactive. Dr. Chris is here for all of you here, and I'd like you to put your questions in the chat. If there are specific questions that you're not comfortable sharing with everybody, if you share it with me and I'll ask on your behalf. But Dr. Chris, thank you so much for coming, and I'm really looking forward to you spending the next hour with us. If you have some slides, colleagues, friends who are here, to please put themselves on mute. Chris, you're a co-host, so you can share your screen.
Okay.
Thank you.
Thank you, Ngozi, and good morning, everyone, for having the opportunity to come around for us to just discuss one of the very important things in our lives, which is looking after the kidneys. As is mentioned earlier, I'm Chris. I'm a consultant nephrologist, a kidney specialist based in Cambridge. So we're going to just have a kind of an interactive section, and what we're going to be looking at, just to keep it simple, just let you know what you need to know about your kidneys and how to keep it well, safe, and healthy. So before we start, I'm going to just show a 2-3 minutes clip which summarizes what the kidney is. Then we go into a bit of talking. So let's watch this.
Almost everything you need to know about your kidneys. They are shaped like kidney beans.
The angels share, it disappears out.
And each one is about the size of your clenched fist. Most people have 2 kidneys, and they sit in your lower back under the bottom ribs. Each kidney weighs about 150 grams. They are the hardest working organs in your body, using 25% of the blood from every heartbeat. What your kidneys do for you. Your kidneys remove waste products from your blood. They create urine, which is stored in and emptied from your bladder, producing 3 to 4 pints of urine per day. Your kidneys filter your blood 24/7. Your blood goes through your kidneys 40 times in 24 hours, traveling through 140 miles of tubes and 1 million filters. They regulate salt and water in your body and produce a hormone which manages your blood pressure. Your kidneys create erythropoietin, which controls the production of red blood cells. They activate vitamin D, keeping your bones healthy. They clean your blood, removing many drugs that some people take for other conditions. If you take regular medication, ask your pharmacist, how might my tablets affect my kidneys? Keep your kidneys in good shape by leading a healthy lifestyle. Keep hydrated. Don't smoke. Keep your weight down. Exercise regularly. Eat a healthy diet, including fresh fish, vegetables and fruit. And reduce your intake of processed food, high sugar drinks and salt. Why you need to think kidneys. Kidney disease is serious, is harmful and changes lives. Protect your kidneys as if your life depends on it, because it does. There are many causes of kidney disease. The most common is diabetes. If you're worried about your kidneys, speak to your pharmacist, GP, or practice nurse. Your kidneys are amazing. They work so hard for you. Look after them. Think kidneys. Find out how to keep your kidneys healthy and safe at www.thinkkidneys.org. thinkkidneys.nhs.uk.
Thank you very much. I hope that summarizes what the kidney is.
Because most of the benefit of these drugs is get at the higher doses. So the short answer is that if you're having hypertension on these drugs,
Chris, please, you're muted.
Okay. Can you hear me now?
Yes, we can hear you.
Okay. So I'll share the screen now. You can see my screen?
Yes, we can.
Okay. So that was a short 2-3 minutes video just that summarizes what the kidney is. And the kidney is a very amazing organ in the body. Anything that happens in the body affects the kidney, and that's why it's very important. And because it's a very silent organ that does amazing work, people most often than not don't actually recognize it. So for me, I think it's one of the organs we take for granted because we don't really know what they do. And we only know the impact of that when it has stopped or almost completely stopped working. That's when you start falling in, because it takes a lot of pressure, does a lot of things in the body. Every organ in the body will eventually get around to the kidneys. So today we're going to be looking at what the kidney do for us and why the kidney fails to work properly and how to look after your kidneys. The short video that we watched just summarizes most of the things I'm going to be saying, but I'm just going to highlight some areas and also elaborate on some few things. So what the kidney do for us? Excretion of waste product. The way kidney works is a lot of things that we eat, we drink, when they get into the system, they get digested, get into the bloodstream, and 25% of the blood that goes through the heart passes through the kidneys. And we looked at how much traffic that goes through those kidneys. And what they do is they keep on removing the waste product as they pass through, because there are some that the body is required and there's some that body doesn't need. So that's one of the key important function of the kidney. So if the kidney is not working, that means most of the things we're eating, most of the things we are drinking, medications, when they get broken down in the body, they are not able to be excreted. So, and that's one of the major functions of the kidney. Electrolyte and fluid balance. When we talk of electrolyte, we're talking of different kinds of salts. We call them sodium, potassium, urea. So those kind of things are things that the kidney regulates. So if the kidney's function is working well, we expect that that level will be balanced in the body. Those ones are going out of the body and those ones are staying. And each of them are required at a particular concentration within the body system. So the amount that's required inside the blood is different from the one that's required in the water space of the body. So, and that's what the kidney does. And it also helps us to balance our fluid. So if you take a lot of fluid, you can see at times when you drink a lot of water, you go out to pass water and all that. So, and there's some of them that are absorbed in the system. The kidneys try to maintain that balance so that we don't get, even if you've drank a large amount of water, the body still have a way of getting rid of that water, and that's what the kidney does. The kidney is very, very important in blood pressure control. It has some hormones that it secretes, which those hormones regulate the blood pressure within the body. And then that's one of the things that we'll be looking at later on to find out, to see how when you have a blood pressure, high blood pressure tends to affect the kidney, because the kidney works effectively to make sure that the blood pressure in the body is maintained at a regular and normal setting. Then we'll talk about the calcium, minerals, the bones. It helps to get our bones stronger because it's involved in activation of vitamin D3, which is used to make the bones stronger in conjunction with the calcium. an acid-base balance. Our body system has a lot of acid and they also have a lot of base. So what it is that the body is not too acidic and is not too alkaline. So it's just to balance it. And the kidney is the one that mainly does that function. One of the other important work that the kidney does is that we do have red blood cells in our body. So the kidney produces a hormone called erythropoietin. So what this erythropoietin does is that it helps the body to generate the red blood cells. So, and that is how important it is, because if the kidney is not working well, that means the effect of that hormone is impaired, and then we'll start having low blood in our system. So it helps in production of red blood cells, which is needed in every aspect of our life in terms of oxygen delivery to the tissues. So move on to the next. So the kidney disease is something that is very common worldwide. And I can tell you that at every age group, as one gets older, the chances of having kidney problem gets higher. However, that does not mean we also have kidney problem from childhood and progresses up to adulthood. So there's so many, but this is just a snapshot of the distribution of people with kidney disease in the country. And this is just United Kingdom. But I can tell you that all over the world, the picture is almost the same or even much worse. Like in the United States, it's even worse. Then of course, we talk about the Afro-Caribbean areas, is even greater. So these are just the proportion of that. If you look at it, you see that from the age distribution, as we get older, the amount of people with kidney disease increases, and it peaks around above the age of 80s. The red one is England. So these are just the 4 countries of the United Kingdom. And this is the renal registry. So it's just giving you a snapshot of the amount of people in the UK that has kidney disease. So if you look at it from the younger age group, it keeps going up, and the peaks are this just about 70s, 80s, and they start going down again. But overall, the amount of people with kidney disease is quite a lot. And then if we look at the Afro-Caribbean community, the number is quite great. And then we're going to be talking about the different causes of kidney disease and how it affects us as a community. Why the kidneys fail to work properly? So what is it that makes the kidney to start not working well? The kidneys, because of the way it's positioned and because of the functions, it does so many work in the body. And most often than not, when the system is not working well, they tend to impact the kidney because it's trying to balance a lot of the salt in the body, balance the blood pressure, so all those functions that it's trying to do. So when any of those aspects is impaired, it's likely going to have a direct impact on the kidneys. For instance, people that have diabetes is one of the commonest cause of, well, it causes about 40% of kidney problem. And of course, it depends on the region. And that is the number 1 cause of kidney disease. And so if you have diabetes and it's poorly controlled, over time, it starts affecting the kidney filtration function. And what that does is that once it starts affecting the kidney filtration function, the kidney function starts getting worse. You start leaking more protein in the urine because the kidney is not able to reabsorb or excrete some of those. So diabetes is one of the commonest cause of kidney problem amongst, well, worldwide, and also among the Black and ethnic minority. High blood pressure is also second to diabetes. And when your blood pressure is not poorly controlled over a period of time, because the kidney function, what kidney does is to help the body to maintain a normal blood pressure. And when you have a sustained high blood pressure, what it does that it's over a period of time, it starts impacting on the kidney function. And about 25% of kidney problems are coming from poorly controlled high blood pressure. So for us, that is very, very important because for Black and ethnic minority, Afro-Caribbean, hypertension is very, very common amongst us. Diabetes is very, very common. So if you look at the 2 commonest causes of kidney disease, diabetes and hypertension, we have them. So a lot of our people have those conditions. So you can imagine if you are diabetic and you have high blood pressure, your risk of having kidney problem is very, very high. So what it means that we look into that very carefully. However, there are some other kidney problems. There are 1,001 things that could cause kidney problem. There are some that are genetic. Those ones you don't know anything about them, they just happen. And those ones we have specific treatment for them. Then there are some that they'll find them in the younger age group. When you treat it, they go. Then there are some that also, because of medication and all that we take, it also affect the kidneys. We said earlier on that the function of the kidney is to help to remove toxic products in the body, and medication is one of those toxic products. So when we take medication, the active ingredients get absorbed in the body and it does this function. Then the one that is not needed is excreted either through the liver or the kidney. So if we have a lot of this medication, there are some of the medication that have impact on the kidney very badly. And when you subject yourself to those medications, it most likely affects your kidney. Then we look at area, because the kidneys produces urine and they pass through a tube called the ureter and goes to the bladder before we get it out as urine. There could be an obstruction in those tubes. So if there's obstruction for any reason, it could be stone, it could be a tumor that is lying around the passages, anything that could just lead to the obstruction there could affect the kidney, the urine flows outside the kidney. And once that does that, it causes a back pressure to the kidneys, and then it start getting swollen, and that will affect the kidney function. So a lot of time when people get older, they have prostate, a large prostate, have all sorts of tumors and all that. That also may cause a lot of obstruction, and that affects the kidney function. The list is endless. Any medical condition is likely going to have impact on the kidney. So if you have heart disease, heart failure, it's likely going to affect the kidney, because what will happen is that when the heart is not working well, the amount of blood that goes to the kidneys are also reduced, and that affects the function of the kidney. So there's a whole lot of, virtually every medical condition will end up affecting the kidneys. If your liver is not working well, there's a level it gets to, it starts affecting the kidneys. So the list is endless. So we cannot finish mentioning what causes the kidney problem, but what we need to know is how to protect ourselves, how to avoid those things causing harm to the kidneys. Then how does kidney problem present? So we have, like what we mentioned earlier on, kidney problem, most often than not, you don't even know that you have it. Majority of the people with kidney problem do not know that they have kidney problem. You only know about kidney problem when it has gone very badly. And that's why it is a very deadly, well, the kidney problem itself is dangerous, because you don't know about it until it has gotten to the level that is, either it's gone to the point of not being able to be reversed, or a point that the things has gone very badly. And that is why it's important for us to ensure that we have early detection of these diseases so that we can treat them appropriately. So the kidney problem can present in different ways. It could present in acutely, and could also present chronically. So acute is when you have a normal kidney function, maybe in a month ago, or 6 months ago, and all of a sudden you became unwell. Maybe you have infection somewhere, you're not eating and drinking well, a lot of things happen there, then the kidney function gets impacted on. And that period, the level of that, it could be bad, but then those ones are good because we can easily treat it and get your kidney back to normal, right? And there's so many things that could cause that, increase the risk of having acute kidney injury, which is what we call it. Those are like people that already have pre-existing kidney problem. The likelihood that if you become unwell, that will affect your kidneys. So when we're unwell, regardless of what the situation, whether it's you've had heart attack, you've had stroke, you've been admitted for infection, even if it's leg infection, it could still affect the kidney. So any form of infection, any form of acute illness could affect the kidneys. And those ones are the one we call acute kidney injury. The good thing about these ones is that they are detected early because the person presents because of a different condition that the person is unwell. And once we get that, we treat it and that goes back to normal function. And we expect that with that, we just give the person advice on how to manage his kidney, and that should be, the person's renal function will get back to normal. Then we have the chronic kidney disease. Those are the ones that are very, very silent. Those are the ones that we don't know about them. We're walking around, we've not been to our doctors for years, and we're thinking that we're healthy and all that. All of a sudden, you buy a house, and they say you're doing insurance, do your urine check, and they've checked your urine, and they say you have protein in your urine. And that is the beginning of a very challenging journey. So most often than not, the chronic kidney disease are the ones that are very, very deadly. Why? Because we don't know about them. We have what we call stage 1 to stage 5. So most often than not, we see people coming to us at stage 3, stage 4, when it's already gone so advanced. Because at the early stage, you don't notice anything. You don't feel any symptoms. So, and that can go on for years and years and years, depending on the type of kidney problem. And when you now discover it, it's most often than not incidental finding. You go to your GP for a regular blood check, and they check your blood and say, oh, your kidney function is gone badly. So, and that will now how we're going to start investigating to know what exactly caused it. And of course, if you have hypertension, high blood pressure, or diabetes, your chances of developing kidney problem gets higher over time, especially if it's not controlled. So those are the things that we have: the acute presentation, then we have the chronic presentation. The acute kidney injuries, they are good in the sense that when we find them, they are usually detected early, and we'll be able to treat them, whatever has caused it, and then it will get back to normal. That's why it's acute and it's reversible. But the chronic kidney disease, they're progressive. Most often than not, they do not get back to, because there's already a damage that's happened. If you're having a leakage in your kidneys and they're passing a lot of protein, what we can only do is to control the progression of that kidney disease. But once it gets into chronic kidney disease, most often than not, those ones will manage them for life until we get to a certain point that we want to prolong their life, the life of the kidney, as much as we can. So those ones are different from the acute kidney injuries. Those ones, we can treat them, they get back to normal, and the person lives a normal life with normal kidney function. The chronic kidney disease, they move from stage 1 to stage 2 to stage 3 to stage 4 and stage 5. Stage 5 will be the time you'll probably be needing some form of, you can't live without having some replacement with your kidney function. So what we normally focus on to make sure that we get them at the early stage 1 and stage 2. At that point, you can manage it very well. So make sure that it doesn't progress to stage 3, 4, 5, because those are not the good ones. The more it goes to those stages, things get a bit difficult. And then, of course, the prognosis is poorer. And within those periods, the person might not even know that he has a kidney problem. So most cases are asymptomatic. So that's why it's very important that we look at how we can identify them early enough and see how we can manage them. I tell you, a lot of times, most of the cases we have in the clinic referred to us by GPs are usually people going to do something for a different thing. Maybe they have an operation, they've gone to do a blood test or one thing or the other, and they say, oh, your kidney function is bad. They refer. And by the time we start investigating, we'll find out that this has been going on for a long period of time. So, and the symptom depends on the cause. We talked about the acute kidney injury. Those ones are usually when one is unwell with a different medical condition, then that will affect the kidneys. Those ones, most often than not, the person will present with the condition that is making the person unwell. Like if you have diarrhea and vomiting, you're losing a lot of fluid, that's likely going to affect your kidneys. So when you come in, we'll monitor that, and then once that is treated, whatever the cause is treated, that gets back to normal. Some have a specific treatment, which we, of course, we do investigation to know exactly what is causing the kidney problem. And once we find out the cause, we'll be able to treat appropriately. So what are the treatment choices for kidney disease? It depends on the cause. And like what I said earlier on is, we can't give you, these are the symptoms you see in kidney disease, because the symptoms most often than not are asymptomatic. So if you are waiting for the symptoms, then we're already talking about the terminal side of kidney disease. So most kidney problem are asymptomatic. It's only very few of them that comes with symptoms, and those symptoms are very specific to some particular kind of kidney problem. But the most important thing is that we have to identify them early enough so that we can provide good treatment before it gets badly. And the treatment depends on the cause. So when we find people with kidney problem, we do a lot of tests to find out what is causing the kidney problem. And some of them are things that will need specific treatment. Some, if it's the one that are related to diabetes or hypertension, then we make sure that we control those hypertension and diabetes very, very closely. Making sure, and once we control it, it helps to slow down the progression of the kidney disease from, let's say, chronic kidney disease stage 1. We try to make it stay at that stage for a very long time. That's the target. So we don't want it to progress from stage 1 to stage 2 or stage 3 over a short period of time. We want to keep it at that stage, the progression very slow, so that that person can spend a longer time with that kidney problem without actually requiring any form of renal replacement therapy. So the early detection is important. We treat the underlying causes, and then also those ones that are specific, we do some kidney biopsy to find out what the cause is. Then we treat the different kind of specific treatment that's given to each and every one of them. Then those ones can recover and the person will get back to normal, but we still get followed up regularly to make sure that we're keeping an eye on the kidneys. However, sadly, quite a number of times, people coming with what we call end-stage renal disease. What that means, end-stage kidney disease, what it means that that person, the kidney function has gotten to the level that he cannot survive without needing support. So that's when we come into what we call dialysis and transplantation. So dialysis is when people's kidneys have gotten to a level that is working maybe less than 10%, and the person cannot function without having some support. So what that means is that dialysis is is a machine that is produced to work like the kidneys. And we have the one that is called the hemodialysis, we have the one that is peritoneal dialysis. And those ones, what it does is that we usually do it 3 times a week, and it just maybe 4 hours, 3 times a week. So you can imagine that kidney that work 24/7, then you're now going to be depending on this machine 3 times a week. So it's not going to do most of the function of the kidney, because like what we talked earlier on, there are so many other functions of the kidneys. The excretory function is what mostly the dialysis does. But then the other function, controlling the blood pressure, helping with the production of red blood cells, vitamin D and bone control, those are other things that the kidney does that the dialysis will not be able to do. So when those people are on the dialysis, we still have to give them some specific treatment that the kidneys would have been doing. So that is the people with, when the kidney goes so poorly that we cannot remedy it. And at that stage, of course, we talk about transplantation. Transplantation is when someone gets a new kidney. So it's usually one kidney that's transplanted. And we expect that with the transplant, the kidney should work very well and back to normal if the transplant goes very well. So we have the live transplant, and then we have the cadaveric. The cadaveric transplant is those ones that when people have a sudden death for any reason and all that, they can actually donate their kidney. There's some of the organ will still be working at that point. So we harvest the organ and give it to someone that kidney has failed, and it is a lifesaver. So people can still, even in death, they can still save another person's life. And once the person have the kidney transplant, the function of the kidneys almost gets back to normal. So most of if the person was on dialysis before, then it goes off the dialysis, the kidney function starts getting better, and that is how that process goes. The other one is a live person donating kidney to an individual. That one, you can still work with one kidney. So the person, one kidney is taken out from another person and given to the recipient, which is the person with the end-stage kidney disease that's requiring dialysis. So, and what that does is that helps the other person kidney function to get back to normal. The person that has donated the kidney can still work well with the one kidney. The beauty of creation is that God has created the kidneys in such a way that even though there are 2, they work together. So when we are talking of kidney not working well, we're not talking of one or two. We're talking of they work as a team. Unless there's a specific structural impact on one, then the other one will have to work harder to compensate the function of the other. But most often than not, both of them work together as a team. So when we are talking of kidney problem, we are referring to both kidneys. So whatever their function is usually together. So the main thing is actually prevention. It's very important, and some of the kidney problems can be avoided. So it's important that we find a way of preventing ourselves, firstly, to even getting into kidney problem, because it's not something that is easy. For us here, we are thankful that we have free access to medical treatment and all that. But you can imagine our people back home, the cost of dialysis is enormous. It is so expensive, and this what it means that if someone gets to that level, it means that the person is going to spend the rest of their life on dialysis. And how much can you spend if you're going to be going on dialysis 3 times a week and you're paying for that? It's very expensive. So what we are looking at is actually helping ourselves to prevent us getting to the level that our kidney will get so badly that we will now get to the level of requiring dialysis or asking for transplants. So that's why this kind of meeting is very important. Firstly, to educate us on how to look after our kidneys, because the popular saying prevention is better than cure, it still stands. If we prevent our kidney from getting poorly in the first place, well, we don't need to talk about those treatments. So it's important that we know how to take care of our kidneys. So we're going to look at so how do we keep our kidneys healthy? So firstly, we need to make sure, like what I said earlier on, this is a condition that you probably don't know that you have it until it gets very badly. So the only way you can know about it is actually by getting yourself regularly checked. So it's not about, oh, I'm healthy, I don't go to GP. You know, a lot of our people, we pride ourselves in saying, oh, I've not been to my doctor for 5 years. That doesn't make you healthy. That does not make you healthy. The only thing that makes you healthy, when you find a health check and they say, oh, your kidney function is working well, your liver is working well, your blood pressure is fine, you're not diabetic, that is when we can say that you're healthy. But because you don't have any symptoms and you've not been to a GP for 10 years, you're bragging about that, oh, I'm not even on any medication. That doesn't speak well as well. So we shouldn't use that as a yardstick for assessing that, okay, we are healthy because we are not on any medication. You might be carrying high blood pressure for a very long time without even knowing it. All those simple, small headache here, small headache there, you think it's just because tiredness. It might be that your blood pressure is very high, and because you don't check it, how would you know? And you might be having it for a very long time until it starts affecting your kidneys. So it's important that we do a regular health check. You can go to your GP, just ask for your blood to be checked from time to time. You need to know what the bloods are. Because if we are looking at the acute kidney injury, a lot of time we have to base it on what your previous bloods are. So if you have not done bloods from a GP for 10 years, and you're coming in and your kidney function is very poorly, we're going to struggle to find, we're going to eventually find out whether it's been going on for a long time, but because you've not had it, so we're just going to say, okay, we just assume that it's all happening very acutely. But it's important that we do a regular health check with our GP. It doesn't cost you anything, it's free, the service is free, so we cannot afford not to miss that opportunity. Even places, people that are listening from other places where you have to pay for your health services, please, it is worth investing in your health. From time to time, you don't need to have headache, you don't need to have symptoms. Just go to your GP and get your blood checked. I just need to have a checkup. They'll do your blood test and your blood pressure, your blood sugar, and make sure that everything is working well. Do a regular check. Check your blood pressure if you are at risk. So if you are at risk, that if you have family history of high blood pressure or diabetes, or someone in your family has had kidney disease, you need to have a regular check of your blood pressure. And if your blood pressure is high, please do see your doctor. they must have to follow it up very carefully. It's not something you say, okay, I'm going to pray about it. It's good to pray, but at the same time, you also have to follow the thing that you need to do to make sure that you're seeking the right help. So if your blood pressure is high, go to a GP. The GP will keep an eye on it until it gets to the, if it's okay, you're going to be on medication, please make sure you comply to those medications. Don't say, oh, this is just a burden, or you throw them away, or you take it when you want. So it's important that we get our blood pressure checked regularly. You don't have to have any symptoms, but as an adult, you should have your blood pressure, know what your blood pressure is. A lot of our people, blood pressure, poorly controlled blood pressure is one of the causes of kidney disease. The ones I've seen from Afro-Caribbean setting is always blood pressure, diabetes, poorly controlled, and that's a land state. So it's important that we take it very seriously. And for males, if you need to make sure you have a regular check on your prostate. I think a few weeks or a few months ago, one of my colleagues, he talked about prostate cancer and all that. So it's also important for you to get that checked, because if it affects your kidney, it can lead to obstruction. That could also lead to impact on your kidney function. It's important that we watch our weight. Obesity is one of the things that has increased risk of kidney disease, because they call what we call metabolic syndrome, and those ones will eventually lead to kidney disease. So it's important that we watch our weight, keep our weight down as possible as we can. Smoking is known to have a high risk of cardiovascular diseases, progression of kidney diseases, high blood pressure control, and all that stuff. So if you're smoking, it's important that you quit smoking. Smoking is not just related to cancer, it has other cardiovascular risk. And because the kidneys work closely with the heart, so anything that's impacting the vessels and all that, and we did talk about the kidneys controlling the blood pressure. So those ones, smoking also affects that. Excess alcohol intake, what it does is that it affects the blood pressure. And if you're already hypertensive, that makes it worse in terms of control. So we have to be careful in terms of how much alcohol we take in. I think it's a 14 units that is allowed for an adult in the UK, but we say that you can actually cut down on that, and that will help to help your blood pressure control. So it's very important. Our diets. Now we've had a lot of, because of the season we are in, and all, there's been a lot of change in diet, processed foods and all that. So people are not eating healthy. It's important that we eat healthy, eat a balanced diet, vegetable, fruits. Make sure that you eat prepared meal rather than processed food. They are always healthier. Eat healthy and keep yourself well hydrated. Make sure you keep yourself well hydrated, especially if you're during the hot weather. Ensure that you drink adequately. And we're talking about water is the best. So don't substitute fizzy drinks for water. So when I'm talking about hydration, I'm talking about water. So it's important that you maintain a good hydration. It helps the kidney to flush out all sorts of waste. And you remember I talked about the kidney helping with the excretion of the waste. Because of the way it works, if you're not drinking much, that's what is going to pass into the kidneys to excrete. So when your urine color is a bit on the dark side, know that you're not drinking enough. So it should be straw colored or clear. So always use that to gauge when you're drinking plenty or not. Make sure you get yourself well hydrated. Exercise regularly. The recommendation, 30 minutes brisk walking, moderate exercise is important. Exercise helps to control your blood pressure, helps to control your weight, and keeps you fit. So it's important that we do that. And if you're diabetic, or if you have high blood pressure, please be compliant with your medication. Have a regular check and make sure that every time you're in compliance, that you're also keeping an eye on your kidneys, because if they're poorly controlled, they affect the kidney badly. So most times when we have diabetic-related kidney diseases, what we do is to make sure that the diabetic control is very good. Because once it's good, we'll be able to slow down the progression of the kidney disease. But if it's poorly controlled, you find out that the kidney disease will progress quite quickly from stage 2, it might jump to stage 4 within a short space of time. So it's important that when we see people with diabetes-related kidney disease, what we do is that to make sure that they have a tight diabetic control, and that will help to slow down the progression of the kidney disease. The same thing with blood pressure. If you have high blood pressure, you need to make sure you're on that medication, do exercise, control your weight, minimize salt intake, because a lot of time the high salt intake increases the blood pressure. We talked about how the kidney deals with handling of salt and water. So if you need to control your blood pressure, also minimize how much salt you take in, because that also is not good for your blood pressure. And compliance with medication is important. Please again, don't say, okay, I'll take it when I feel headache. Take your medication regularly. And when you're taking your medication for blood pressure, even if the blood pressure is within normal, don't stop, because when you stop, the blood pressure goes up. So we expect that when you're on a blood pressure medication, that is for life. Don't say, oh, I'm just going to take it for 1 year and then stop. Please don't do that. Don't do that. The doctor can regulate your blood pressure medication and all that, but please don't for any reason stop your blood pressure medication. If you've been on blood pressure medication, unless a specialist or your doctor has said, okay, we might have to cut down on this, but not on your own, say, okay, I'm not taking any blood pressure medication. If you have any side effects from the blood pressure tablets or any of your tablets, please discuss it with your GP. They're going to review that. We have 1,001 alternatives to use. So please, if you have a side effect from one blood pressure tablet or any of your medication, don't stop it. Just report to your GP. They will look at your medication and give you alternatives. And it is important. Why I'm saying this is that a lot of time we'll see people coming to us and they've been diagnosed with hypertension 5 years ago. Say, oh, I took my medication for 1 year and I stopped because the blood pressure is normal. And then you're seeing the person because the patient has got kidney problems. So please, it's important for you to comply with your medication. I can't overstress this because that is one of the things I've found out with our people. Poor compliance. They don't attend to a clinic appointment. When you talk, they tend to prioritize the other life activities more than their health. At times you say, oh, I have to do this meeting and I can't come. So we need to put priority to our health. So if you've been diagnosed with diabetes, hypertension, or any illness at all, please comply with those treatments. The doctors are there, the specialists are there. They want to help you, and you also need to be part of that treatment. Avoid over-the-counter medication. There are a lot of painkillers we take, which is, you can buy them over the counter like ibuprofen, diclofenac. Those are not good for the kidneys. So please, if you are taking such medication, be careful, because if you're taking it for a long time, it will end up affecting your kidneys. And when they get that, some of the impact they have on the kidneys, some of them might not be reversible. So please, and it depends on at what point we'll be able to pick it up. So if you're taking any of those medications, you have to take it for a short period of time. Don't take that over a long period of time because they impact on your kidney badly. There are a lot of herbs, there are a lot of things that are coming up now. People are coming up with, oh, this one is a sleeping tablet, this one is so some of those are very dangerous to the kidneys, because the kidneys function is to help the toxic waste in the body. So when you're taking some things, some herbs, some medication for weight loss and all that stuff, the kidney tries to remove it from the body. And in the process of doing that, they start damaging the kidneys. So it's important that some of the things we are taking in, they're not good for the kidneys. So we have to be very careful. Only take prescribed medication. I know a lot of us, because of our belief, and we have all these herbs that you put in the bottles, roots, leaves and all that stuff, and just all sorts of concoction. Yeah, there's some of the herbs are medicinal, but it's only good when you know the right doses, when it's been extracted and say, okay, this is how much amount of it you can take for this particular condition. But most times what we do is that we have this one herb that kills every kind of disease. So we take those kind of herbs because we are taking it at unmeasured quantity, unverified effects. What normally happens, you take it over a period of time, the person develops kidney problem, and when you're talking, you say, oh, you want to link it to, oh, it was when I did ABC. They always want to link it to something else. Please, if you're in the habit of doing that, kindly desist from that, because those are things that have significant impact on the kidneys over a period of time. Seek medical advice if you notice any symptoms. If you are unwell, don't ring your friend and say, oh, I'm having this problem. Your friend will be the doctor and prescribe. We're quite fond of that. You know, somebody is having abdominal pain and all. So I use this when I had abdominal pain, use it. Please, if you have any symptoms, seek appropriate help. And now that we're in the era of social media, people can Google anything, abdominal pain, what does it cause? And they'll give you a long list of, there are people that are putting those things down. That does not mean that are verified. So information you get on social media cannot be trusted because most of them are not verified. So if you type in, okay, I have this, what happens to it? You want to use the Google to find your symptoms and make diagnosis. That is absolutely wrong. So you have that some websites that are trusted, you can check what is going on there. But please, if you have any symptoms, seek medical advice and seek it early. One of the things that I find out among our people is that we present very late. And when we have late presentation, it affects on the outcome, because one, by the time you're presenting, the thing that we would have done early, we would have missed that opportunity. Because we would have done a lot of things, we would have spoken with their friend, gone to different things, we do all sorts of things before eventually getting to the doctor. Please always seek medical attention early. So what to do if you have kidney problems? So if you, for instance, if you see your GP and they say, oh, you've got kidney problem, I'm referring you to a specialist, just be calm, don't panic. There are things that there are people that are there for to understand what is going on. They'll be able to provide the treatment. So when you're told that you have kidney problem, that's not the end of the world. Just be calm, listen to what the doctor is saying and follow that instruction. Don't say, okay, this doctor doesn't know what he's doing, and you leave the doctor because he's told you that, oh, you have blood pressure and you have to be on medication. Then you leave the doctor, you might not go for a follow-up and all that. Please keep calm, understand the kidney condition. Most times when you go to the specialist, we try to spend time to explain to our patients what the actual problem is. If you do not understand what is going on, please do ask. And it's always good to go with someone else. But what I've observed from our people is that when they have issues like that, they don't even come with someone else, they go alone. And when they go alone, the way they attend to it is not as serious as you'd expect. So it's important that you understand the seriousness of the problem and follow it through. Make sure that every step of the treatment or investigation, you know what is going on. And if you are giving medication, ensure you take your medication and don't miss your follow-ups. If for any reason you have to miss any appointment, please do get in touch with your team. And most kidney diseases are managed well once we detect them early. But the problem is that a lot of our people, not only our people, a lot of the cases, have some cases that just last week, somebody just presented normal kidney 3 months ago, and then now the person is on dialysis. And these are things that the person will just thinking, is this thing that happened to my life that made this? No, it's not. But late presentation, regardless of whether the outcome is always poor. So it's important that we make sure we present early. And the only way we present early is that getting ourselves checked regularly. So one can still live a good quality life with kidney disease. So if you have kidney disease, I mentioned that there's so much advances in management now that I have patients that have been on dialysis for 30 years and are doing well. Some of them go to work, come back, have their dialysis and move on. So there are a lot of, the treatment has been so advanced that it's not before, in 20, 30 years ago, there are some people we don't even put on dialysis, but now we have people in their 80s, in their 90s, still coming for dialysis. Before now, 30 years ago, in this country, we don't even consider those people. If you are 70 and above, we have kidney problem, we just kind of manage that. But now, because the advance in treatment has gone so nicely, we are now treating even very elderly ones, and they're doing well. So you can still live a good life with kidney disease. But then, what I want to conclude today with is organ donation. We have a lot of challenge in our community, because a lot of times when our people with kidney problem end up requiring dialysis, when you're on dialysis, the next thing is to look for possible transplants. So if you are put on the transplant list, people from Afro-Caribbean ethnicity always stay very, very long. And from my experience, we hardly get a donor. And why is that so? It has nothing to do with the system. It has to do with because we do not have a matched donor. So what the national pool does is that they just check it all over the country, and then the people, once a kidney comes out, they just match it. The person that has the closest match, they'll send it to, if the person is in Manchester, even though the kidney is in Cambridge, they'll send it direct to that person. So that's how it works. It's well programmed. And if we don't have our people donating kidneys, the chances of us getting matched with a Caucasian is very, very slim. And I can tell you from experience, I probably have seen maybe 2 or 3 blacks having end-stage renal disease getting matched with the national kidney donor. Is that scarce? And the reason being that our people, we do not donate. Even we still want to keep ourselves. We're so self-centered that even in death, you don't want to save another person's life. Because what we are talking about is when the person is gone, that kidney can help another person, save another person's life. Thankfully, the law has changed now, so you have to opt out. So what it means that if for any reason anything happens to someone, the organs will be donated to people that will need it. So, but I want to encourage us, because I've seen a lot of people sending stuff on social media, trying to discourage people to opt, or trying to urge people to opt out. Please don't do that, because it could be you, or it could be any of your relatives, it could be your friend. And if we don't have a lot of our people donating their kidneys, the chances of us saving people from our own ethnicity is very slim. So it is important that we take it very seriously. If you hear someone say, okay, you have to opt out, the government is trying to put everybody so that they will take our, no, that's not true. We're just trying to, what you're doing is to help someone in debt, to save someone else's life. So I will conclude in this. So I want to encourage you, if most of them must have registered with organ donation, but if you've not done that, please do, because the law has changed, and we encourage as many of us as possible to make it. You should have your organ donation card, so that when it happens, it shouldn't be your relative that has been making that decision for you, because that will help save another life. I think I will stop for now and just give room for questions. Thank you.
Thank you very much, Chris. There are lots and lots of questions. So I'm hoping that we can get through. Yeah, there are lots of questions. So what I'm going to do, I'm going to go through them, but if you could keep, so we can get through the questions, because we only have about just over 15 minutes now.
Yeah.
If we can keep the answers concise,
Yeah.
because there are lots and lots of questions.
Okay.
Okay. You can stop sharing your screen if that's okay.
Okay, that's fine. Yeah.
Okay, so firstly, thank you so much for your presentation.
You're welcome.
I know that many people would have found that really helpful and really useful for them. People who attend our health hours are people who want to take control of and look after themselves a lot better. And many of the things you alluded to are things that our previous speakers have come and helped us out with. I personally now measure my blood pressure twice a week after having a cardiologist on the call who told us to do that. Okay. So one of the first questions we have is something to do with EGFR, and the fact that somebody's score was adjusted because of our race. So is your kidney function different if you're black than if you're white?
So what we call EGFR is just estimation of the kidney function. So there's a way it's calculated. And because of the way it's calculated, people of ethnicity, they tend to have a higher muscle mass. And those are the things we have to adjust it in any form of science, in any form of research. We have to make adjustments to different category of people. So if I'm seeing an Asian with a creatinine of, let's say, 70, it might not be normal for that person. But if I'm seeing a black with a creatinine of 100, it might be normal. So, and those are just the body composition. We have a higher muscle mass, and that's why it has to be adjusted. That's the only way we can actually have a closer to estimated range, and that is an estimate. So it's not what we do. If we want to assess the actual kidney function, we go through a different medicine test where we have to now test the exact function of the kidneys itself. But what we're doing, we're using a formula to calculate the kidney function, and those formulas that we have variances like sex, age, body mass, and all that, and size. So those are the things we have to adjust them. So for the male and the female is also different, and that is what is the same with all different kind of parameters in science. So we adjust it based on either sex, age, or size, body size.
So I think the real concern is that you go to a doctor, you have a blood test, and they tell you that we're adjusting it because you're Black. So that if you are not aware about these adjustments that you've talked about, you begin to be worried, because some of these tests came into play many years ago, and whether that still holds. So it just, I suppose if I went to the doctors and they said, and I wasn't aware and I wasn't a doctor, and they said they were adjusting my range because of my skin color, it would just be something that would worry me. But what you're saying is that it's not something to worry you.
No, even the adjustment will still come up with it. So if it's been adjusted, it will still tell you what it is. Like if his GFR is above 90, it's already adjusted it automatically.
I think for the lay people here, really, the EGFR, the numbers and things like that don't really matter. I think it's the message about the fact that it's different because of our race. And all we want to just establish is the numbers they're giving us. Is that fine for us? Is that right?
Well, it could also be misleading. Okay. It could be misleading in the sense that, and which is what I always tell people, that it's not just enough for someone to say, oh, it's because of your race. You need to find out exactly what the number, because even with the adjusted rate, it's still within normal. It should be within normal. Okay. So if someone has come in and said that his creatinine is 120, it's not normal, even though if you adjust it, it will be lower than someone else, but that is still not normal. So we shouldn't be taking, if you've done a blood test and they say, okay, your GFR is this, and they're adjusting it, they're not the one adjusting. The adjustment is already been done in the lab, so we just come up with that. So they shouldn't be telling you that they've adjusted it because of whatever you're seeing there is what it is.
Okay.
So, and then don't say because you're Black or that you have a high creatinine, and they say just do and sleep. No, you should not take that. So it's only if it's normal, it's fine. But if there's any problem with it, you have to look at it very carefully. So nobody should tell you.
The people have asked this question, because there's more than one question.
Yeah.
They've been given a number.
Yeah.
They've said it's been adjusted for their race.
Yeah.
What should they do tomorrow?
So if they've been given, so what normally, the first thing they want to ask is that adjustment normal? But even though it's adjusted, because the lab would have adjusted it and you will write it and the blood form and all that, even if it is adjusted, the question you ask, is that adjustment normal? So if it's not normal, then they should be following it up.
Okay.
So it's important that you also ask the question, this adjustment, is it normal? But it could be adjusted and it's normal. It could be adjusted and it's already on the high side of normal. So if it's on the high side of normal, then you have to be rechecked.
Okay.
Then you have to have.
So the main thing is that whether it's adjusted or not, it should be within the normal range.
Yes. Yes.
So really, we don't know whether it's for men, for this. I want my GFR within the normal range, and that's what she's being told.
So yeah, so you have to know whether it's within your normal range. So regardless of whether it's adjusted or not, you have to ask, is it normal? If it's not normal, then you have to follow it up.
That's fine. So I don't need to worry about them telling me it's because you're Black, is this. Just tell me, is my EGFR normal?
Yeah.
Okay, and that's the message. The number of people have asked that question. Is your EGFR normal? If it's not normal, you need to do something about it.
Yeah.
Thank you.
Okay.
Another question that lots of people have asked is, can herbal remedies interfere with kidney function?
Yeah.
I know you referred to it, but I think there are a number of questions about herbal remedies and using other things to control aspects of your lifestyle. So I think it's important to just emphasize about these herbal remedies. I think it comes up in all our sessions.
Yeah. So I think when we talk about lifestyle modification and all that, there are a lot of things we can do in terms of exercise, eating healthy. We know what the healthy diets are. The herbal remedy, the challenge we have with them is because the kidney excretes everything that comes into the body. So it just handles it. So, and some of them have been tested, so we know what is in this kind of remedies. Some are not tested, and some has got toxic content that when the kidney starts excreting them, it will start affecting the kidney function. So it's important that if you're taking a herbal remedy, you should be able to find out if it's one that has already been verified, find out what is written about its effect on the kidneys, because normally they should have that written down. But if it's the one that we're just doing ourselves, that is very, very concerning, because one, we don't know the quantity, we don't know what the active ingredients are in those things, and the active ingredients will still be broken down to the ones that are not used, and we don't know how toxic those ones are. So some of this thing has to be tested, and because they're not tested, we have to be very careful in use of those, because you can say that it's working for your arthritis, but we don't know what impact it has on the kidneys. So those are the things that, and it's only when we put things through research, we'll be able to figure out how best, or how effective they are, and how the impact it has on the kidneys.
Okay. We had a GP a few weeks ago that told us that, you know, the health man checks and the healthy woman checks as routine have been stopped.
Yeah.
So that I think they used to call everybody at a certain age, but that's no longer the case. So for the hidden disease, and we don't want people here to find out that there's a problem when you go for your mortgage. And I think the regular checks were quite good, but if they're not there, at what age would you say we need to go and get a sort of well woman or well man check at our GP?
Well, I think for the NHS, they put it from 40. If you're 40, we're expected to have a letter from your doctor and get checked. And then they'll do the initial check if everything
I think they used to, but a GP was on a few weeks ago and said that the routine checks have stopped.
Yeah, well, I guess it's all about the pressure on the GPs and all that. But I think the right thing to do is still, however you're going to do that, you have to get it checked, because especially if you don't get it checked, like what will happen during the COVID period, there are a lot of things that people have lost to follow up and all that, and they're coming back now with very bad complication and outcomes. So we have to understand that whatever the system is doing, it's not doing, it's just trying to adjust. What we do is that we look at, okay, this number of people, we've done a check on 100 people, even though it's 20 people that, or 15 people that we picked up, then I say, do we need to be doing it for everybody? And it's just those kind of evidence practice. But that does not mean that those checks are stopped. You have to take your own responsibility and find a way of getting it done. Okay,
so that's it. So a message for people who are listening in, even though they don't call you, you can still go. And so especially for Afro-Caribbean people who we have a higher rate of kidney disease and blood pressure, we can still ask for that check. So even if they don't ask for you, we should go and ask for it ourselves.
Yeah. And then if you have, you can buy the blood pressure machine at home and check it yourself. And if it's high, anything above 140/90, go to your GP and say, well, I've done my blood pressure and this is what I'm getting. So you can also take that initiative. But for the blood sugars, you have to get that checked. So those are things that I think we should take that responsibility and make sure we get it done regularly.
Okay. And Charity has said that she bought herself a blood pressure machine from Amazon, and her and her family now all check their blood pressure, and she wasn't aware she was walking about with high blood pressure. So thanks for that, Charity. And you wouldn't advocate, because I've heard someone say, well, I saw it, you know, the internet has got so many things on it. Yeah. But I remember someone saying that if you're worried about diabetes, you could taste your urine. And this is not something I would do myself, going to be sweet, but I know, and that's why I say the dangers of the internet. But for protein, that you wouldn't know anyway, because it probably would taste no different. Not that I've tasted mine, but it's just.
Well, nobody is advised to test their urine, but we normally say, we say that the diabetic, their urine is sweet, but then that doesn't mean that because it's tested, nobody asks you to test your urine or anything. But
some people have, though, because it's out there. I saw it the other day and I was just thinking, who would do that? but some people have.
That's a very kind of, so I think what I will advise is that we can still get our blood sugar checked. You don't need to, but most times that even if you have diabetes and all that, the symptoms, if you're waiting for when you have the symptom that you're having, passing increased amount of urine and taste, very thirsty and all that stuff, you already get into a serious stage. So it's also good from time to time, when we're getting our regular check, we get our blood sugar checked as well. So that is, so we detect it early, because when you are getting to the level that you're now testing your urine and all that, is already a more advanced diabetic stage. So what we're looking at actually the pre-diabetic one that you can control with food, weight loss and all that stuff. So you don't go into medication. So it's still important that I think though even the blood sugar checks is available on booths and all that stuff, we can still get that and check it ourselves. So, and they will tell you what the normal readings are. So it's important that some of these are just simple things we can do to help ourselves rather than, I strongly advise anyone not to even consider touching their urine, not to talk of testing it to know whether it's sweet or not.
Yeah. Oh, honestly, nobody here. That was just a information I found on the internet. I'm saying just completely ignore.
Yeah.
Not part of our health at all.
Yeah.
You said lots of times to keep well hydrated. How much fluid is that?
Well, so we're looking at the kidneys on a regular basis gets around 2 to 3 liters fluid. So I think that should be a reasonable amount. And of course, if you're in a hot weather, you're losing a lot of fluid, you need to drink more. And if you're exercising, you have to drink much more. So you have to keep yourself well hydrated.
Okay.
And that's water.
Thank you. There's a bit of a concern. You know how you say it's very silent, and people have asked, so is there nothing at all that alerts you that you have kidney disease? Because you know how with diabetes, they say maybe you get a bit more thirsty, you're passing a lot more urine. So with kidney disease, someone's asking, is there nothing at all that you will find out if you have kidney disease that is
so
sort of symptomatic?
Those ones are usually, like what I said earlier on, there are some kidney problems that come with another condition. Like if it's acute kidney injury, kidney problem that are just happening acutely. So if you're already unwell from something else, we'll find out that your kidneys are affected. But that the symptoms are not from that kidney being affected. The symptom is because you're unwell from something else, maybe infection, water infection, or anything else. But then the kidney itself, most times the things we find with the kidneys are usually when we do the blood tests, to be honest with you, majority of them are asymptomatic. It's only very few of them that you have this swollen, that they have a leg swelling and all that, which is very specific. And those are the ones we call what we call the nephrotic syndrome. And those are the ones that come with leg swelling, facial swelling, and when you pass water, it's just kind of very foamy. So those are the specific ones that you can say, okay, this one, if your leg is or your body is getting swollen and all that, there's a possibility that you have a kidney problem, because if you are leaking a lot of protein in your urine, you're likely going to have some swelling. So that's the one that's very specific. But majority of them, you don't really have those symptoms until they get to the level that have already affected the kidney badly. Then you start having those symptoms, and those symptoms are what we call the determinants. They're not really symptoms that we don't want it to get to that level. So the most important thing is for it to actually, like when you are there, you're already very unwell, so you probably will be going to your doctor.
And that brings me to a question from someone called Teresa P, who said that her sister was given medication which made her feet swell, like what you've described, all the way up to halfway up her leg. So the doctor ended up sending her straight to hospital, and they asked for a biopsy of her kidney. So this is like what you've described, isn't it?
Yeah,
So they're saying what sort of thing might have happened to cause this is the question.
So because the one with that's medication related, like if there's some specific blood pressure medication that when you take them, the initial time you're going to have ankle swelling, which the doctor would have explained to the person that you have ankle swelling, and they will resolve over a period of time. But if it's not just ankle swelling, if it's swelling up to the thigh or knee, then that is not related to the medication. And at that point, the GP or the doctor would have done blood test, urine test, and will be sending the person to the specialist. And when we get to the specialist, we have to do kidney biopsy to find out exactly that's causing that problem. And once we find it, I will be able to give adequate treatment for it.
Okay. Someone said that if your kidney function gets to 52%,
yeah.
What can be done? It's very specific. So I presume that this person's been told this is their kidney function.
Yeah.
What can you do to get it from stop it from getting much worse?
So if it's 52%, depends on what kind of, whether you're diabetic or hypertensive, because if it's at that level, we should also look at whether whether you have any protein in your urine, and that will determine if you have protein in your urine, you'll be seen by a specialist. Okay, but if you don't have any protein in your urine and you're not diabetic, you're maybe hypertensive, most often than not, if that has been seen by a specialist, we say, okay, this is just chronic. What we normally do is that we look at the things that will slow the progression of the kidney disease, which is good diabetic control, good high blood pressure control, and those ones, when we tightly control them, they will help slow down the progression of that EGFR from 52 to anything else. And then making sure that if for any reason the person gets unwell at any point in time, regardless of what it is, whether it's chest pain or headache and other issues, seek medical attention. And taking of medication, that person also has to be very careful in terms of what kind of medication it takes and all that. You need to ask your doctor, is this medication safe for the kidneys? Anything you're doing, you have to be very mindful, because that level of kidney function, you are now at a risk of getting it worse if you don't take care of it very well. So so it depends on what other existing condition that the person has. And if it's just that straightforward and it's been checked by a specialist and say this is a stage 3 or stage 2, depending on whether it has protein or not, then they will just follow up. Some of them will be followed up by the GP, or the specialist will follow up if the person is lacking protein and has other underlying condition. But we can, with that one, monitoring the blood pressure and all that, not by the person itself, but by the specialist. There are a lot of different medication we use and all that. And the target blood pressure we have is different from those ones without kidney problems. So it's the specialist will be able to monitor that and make sure that the progression is very slow.
Okay. There are lots of food-related questions. So any foods to avoid, and whether if you're vegan or vegetarian, let's just see, Sizimo, if you have a vegan or vegetarian diet, can that impact on your kidneys?
No.
And if you have kidney disease, what foods should you avoid?
So most times with the advances in treatment and all that, there are some specific, depends on the stage of your kidney disease, which of course, if it's the end stage, we have dietary restriction and all that. But if it's just early stage of kidney disease, we don't expect that you should, apart from what I've explained before, to eat healthy, low salt diet, because we know that salt is not good for the blood pressure in the first place. And then all the high processed foods, eat vegetable, fish, all those healthy diet kind of pathway. It's only when we get people with end-stage kidney disease, we start restricting some specific foods that because the kidney are no longer handling the waste very well. So if you take certain food, when they break it down, they might have certain substances that are high in the body, which the kidney will not be able to excrete. So at that point, we start kind of dietary advice on those, and those are usually those ones at the end stage of the kidney disease. But if it's just early stage of the kidney disease and your kidneys are working well, we expect that with healthy diet, low salt diet, low sugar diet, because we also need to control your blood sugar and all that. And then those should, and then reduce weight, especially obesity is one of the things that makes it even worse to control progression of kidney disease.
Thank you. So the last question I'm going to ask is about donation.
Yeah.
Because there are a group of questions about donors. So you start off by saying that kidneys work as a pair.
Yeah.
And you talked about 2 types of donors. So one's a living donor, and one's donors from people who have passed.
Yeah.
So for living donors, if your kidneys work as a pair, is it still safe to give one of those kidneys to somebody else?
Yeah, very safe.
Okay.
Yeah, it's very safe. Of course, if you're giving your kidney, you have to be monitored closely because the chances of you having hypertension is very minimal. But then there's still risk of you developing hypertension at a longer time. But those are things that, in terms of the kidney function, is safe to donate.
So that's you as the donor, because what they do is they follow up the person who has donated.
Yes.
So why are they following me up when it's safe?
Yeah, no, when you've donated, when someone has donated the kidneys, first we need to make sure that that one kidney will be working well. So what happens is that the kidneys start working more. But before, two of them were working, so each of them were sharing the job. So when this one is no longer there, that one will start doing all the job itself. So we expect that that job is doing will cover. Most times that's what happens. So even if the person has not done, let's assume something happened to one kidney. Maybe someone lost his kidney, maybe there's some other condition that the kidney is, one kidney is just small, it's not functioning anymore. That other one will be working extra hard to do the work of the two. So it's still safe. But of course, we have to follow up in the first 1 year, and after that, the GP can monitor as any other person.
Okay. So the overriding message is that if you have two healthy kidneys, it is safe for you to donate one of them.
Yeah.
Now, the other thing about the donor register, you're quite right that it's now an opt-out system. So we are all opted in,
Yeah.
and you have to say whether you want to opt out.
Yeah.
In actual fact, it doesn't put the number of donors up that much, because when somebody has passed, they'll ask the relatives, and many relatives still say no. And if the relative says no, we can't use it. So I would say make your wishes known so your relatives feel comfortable in making sure your kidneys are donated. And the other thing that people worry about is that they say, oh, they switch off the machines because they want to take some of our body parts, because if you've got to still be alive. The number of things I've heard, but I think it's valid, people's valid concerns.
Yeah.
And so because they're valid, it's important to address them.
Yeah.
That if you do have people, if you can just explain what happens at the end, so we can encourage people to, if their relatives have made their wishes known, because we even have that where relatives have said, I'd like to, and when they've passed on, their relatives say no.
So what happens? Yeah, what happens is that it's not most in hospital it's not our wish that people die anyway. So it's not like we are not waiting for someone to die so I get the kidneys out. And most times it's not every kidney that is even good to be donated. And then it also depends on what the condition that led to the death is. Because a lot of time, if the condition is not good, it's not every death that will harvest the kidney. So that is number one. So it's only on specific occasion when we have healthy people that maybe sudden death, road traffic accident, then at that point, at the point of death, we will still be able to get the kidneys out. So it's not like the person is still living and you want to start it. No, it's just that it happened quickly, and then because you already have that window of opportunity, that can be done. And before, if someone is in ventilation and then they are considering that, there's a process that is in place. They have to have 2 or 3 other independent reviews. So it's not just the doctor that's looking after the patient. Okay, we want to switch off the machine. They have to get someone independently, another consultant, to also assess the patient and make sure that the patient is brain dead before they can. And then after they've confirmed and certified that this has fulfilled that criteria, there's a law governing donation, especially when someone is, so we still have to follow that. And it's not just the managing physician that takes that responsibility. There are all going to be 2 or 3 other consultants who is independent of that circumstance that's going to come and assess, and then now everybody will now agree that this is the right thing to do before we go ahead. So that's how it works. So people don't just go and say, okay, let's switch it or so I can get the kidney out. It doesn't work that way.
Thank you so much for clarifying that.
Thank you.
It's been a fantastic session. I know we've overrun everybody, but I thought it was really important to get all the questions that people had asked out, so that now that we have the opportunity to ask Dr. Chris directly these questions, because we know that kidney disease is one of the things that is really, really important for our community. And we just need to get a bit more information about it. And you've done that fantastically today. So thank you so much.
Thank you very well.
We like our health hours to be interactive, and this has been very, very interactive today. We also like to go away with important information, and you've given us that today as well. And so thank you for your time. And thank you for everybody who logged in. And I hope I got to all the questions, but this was a really great session. I feel healthier for it already.
Thank you very much. If you have any further questions, you can still send it to your email. I'm more than happy to address some other questions if someone feels that the question was not addressed.
Thank you so much.
All right. Thank you very much for the opportunity.
As usual, have a lovely afternoon. And we will be here next week. And next week we'll be joined by a colleague who does oral maxillofacial surgery, quite niche, but as well as doing that as well, he also won an award at the for Black healthcare, and because he set up a charity called Touched by COVID. So I'm really looking forward to speaking to Dr. Robert next week, and I hope I see all of you. Please enjoy the rest of your Saturday, and I'll see you next week.
Thank you very much.